Hey again, everybody. Dave Doyle from Spectrum Physical Therapy and SpectrumPhysicalTherapyCT.com. Just want to answer another question that I got posed by some patients as well as some friends of mine, and as well as sometimes I hear from local physicians when I talk to them. Aren't all physical therapists the same? Well, no. The answer is definitely no. Physical therapy it's a great profession. It's now a doctorate profession. But you can be a physical therapist. You can work in a hospital and do acute care. And so you're seeing folks coming off surgery, and for the first couple of days. You can work in a pediatric setting. You can be a physical therapist. You can work in many different settings. You can work in skilled nursing facilities. Even among outpatient orthopedics, in which that's what I work in, not all physical therapists are the same. Okay, what we specialize at Spectrum is we are constantly going back and learning new techniques and new philosophies on manual therapy. And the reason for that is we try to stay on top of the evidence, meaning that what is the new research showing on what's the most effective way to treat patients. So in terms of looking at a spine patient, someone who comes in with a cervical spine problem, once we clear and make sure there's no issues in terms of any fractures, any red flags, what the research shows is cervical manipulation, which is that high velocity, low amplitude thrust manipulation. We'll do those here. Not all physical therapists are trained in doing that. We also use different techniques in terms of intramuscular dry needling, where we'll actually use acupuncture needles and insert them into muscles to try to alleviate pain and alleviate muscle soreness, and not all physical therapists are trained in do that as well. Okay, and when it comes to exercise, we tend to, again, we differ from a lot of physical therapists. We're not going to just keep you on the table doing table exercises and, maybe just, squeezing the quad muscle and doing some of those things. We're going to get you off the floor. We're going to get you trying to replicate basically what you do back to work, using different things such as teaching you how to squat. How do you do a deadlift? And why are you doing a deadlift? What is the point of that? Well, a deadlift is something where you bend over to pick something up, which could replicate picking up groceries. All right, and so we work with patients who might want to just pick up their grandchild from the floor without pain, or you might want to lift 800 pounds off the floor. And those are things that a physical therapist needs to be able to, from a strength and conditioning perspective, know how to coach that movement, teach that movement, correct that movement. And that's what we do as well. So we're trying to blend a little bit of strength and conditioning as well as high-level manual therapy into our practice. And we think that's a really good approach, because we can obviously we want to get rid of your pain first of all. We want to improve your function, and then we want to try to teach you some things to manage it or get you to the next level in terms of whatever your particular goal is. So hope this helps a little bit in terms of explaining as to, are all physical therapists the same? Because the answer is definitely no. All right. But again, keep listening. I want those comments back. So any other questions that you guys have, I'd love to talk to you guys about that, and it's helpful for me as well. All right. Again, Dave Doyle, Spectrum Physical Therapy. Thank you very much.